busy time of the year. I want to take a minute first just to acknowledge the devastating impacts we've seen of Hurricanes Helene and Milton. And our thoughts are with everybody affected, and we really hope for a quick recovery for everyone involved. And please let us know if there's anything we can do to help. I also want to acknowledge that with the election just around the corner, it's a really intense time for public health, and we hope today's session will help us understand a little bit more about the potential impacts on our field and what this could mean for our future work. Let's go to the next slide and move on to some exciting upcoming events. Oh, and Susan Pullen will be facilitating our session, so I'll turn it to her in a minute. But we're really looking forward to our APHA annual meeting later this month. We often skip this meeting because it's such a busy time, but thought with the elections, it was an important time to have a chance to focus on these really key issues. But our meeting will be, it's a week and a half away now, October 27th to 30th in Minneapolis, and we hope to see a number of you all there. Our theme this year is rebuilding trust in public health and science. And we know that that's really important to strengthen the public health system. And we hope many of you can attend and be part of these discussions. With the upcoming holidays and everybody's meetings, just wanted to let you all know that we're actually going to combine our November and December meeting and host one on December 4th instead. So look forward, we'll change that later, but apologies for the gremlins that have been clearly acting in our Alliance website recently. I know you have gotten a lot of meetings, but that's a real one. We really will be canceling two and starting a new one, so stay tuned. If we can go to the next slide, just wanted to give you all a little bit of a flavor about the annual meeting. We have a slide on the movement that we're fortunate to have a number of our partners joining us for. We're going to have a couple sessions that you'll see here on public health advocacy, sessions on litigation and the impact of how lawsuits impact public health in the states, focusing on Public Health AmeriCorps and some of the lessons from that initiative. They also will be in a Say Hey Lounge. In terms of the conference itself, of course, we're excited about the focus on science. We're going to have some of the folks from Invisible Shield join us and play some clips of that as one of our plenaries. We're going to focus on how we can make public health a national priority, the theme for our next conference at the end of the meeting. So wide range of communications, advocacy, equity issues for everybody. We also will be hosting, APHA is hosting a town hall on Tuesday night for a topic that we heard was important, note of interest to a lot of folks, which is looking at Project 2025 and the ideas behind it and what we can do to think about how to prepare to address some of these issues. And so really hope to see you all, if you're available, on Tuesday night in Minneapolis with us. Finally, we will have an Alliance booth and also be there with our colleagues from IP3 talking about our Public Health and Equity Resource Navigator. So please come visit us, say hi. We have some chapstick and other handouts and stuff, and would like to have a chance to talk to you all and hear about what you're doing. Also, if there's sessions you have or events that you'd like us to share with the group, please send them or put them in the chat now, and we'll make sure to share those with others. Let's go to the next slide, please. And we'll now turn to the main focus of the event, and I will turn it over to Susan Pullen, who will be facilitating our great discussion with KFF. So thank you.
Good afternoon or good morning, everyone. It is my pleasure to introduce this panel that we're going to have today. We're going to talk about, as Angie said, the potential impact of the upcoming election on the public's health and equity issues. We're fortunate to have two great speakers who can really speak to this issue in great detail. So let me first start by introducing Dr. Jennifer Katz. Dr. Katz is the Senior Vice President and Director of the Global Health and HIV Policy Program at KFF, where she oversees policy analysis and research focused on the U.S. government's role in global health and on the global and domestic HIV epidemics. She's also helped to lead KFF's work on the COVID-19 pandemic. She's widely regarded as an expert in the field and regularly publishes and presents on global health and HIV policy issues, and is particularly known for her work analyzing donor government investments in global health, assessing and mapping the U.S. government's global health architecture, programs and financing, and tracking and analyzing major U.S. HIV programs and financing, and key trends in the HIV epidemic. She's been working on these issues for close to 30 years. Our other speaker will be Cynthia Cox, who's the Vice President and Director of the program on the ACA, where she conducts economic and policy research on the Affordable Care Act and its effect on private insurers and enrollees. Her work focuses on enrollment, pricing and competition, in the ACA's exchange market. She also directs the Peterson-KFF Health System Tracker, a partnership of the Peterson Center on Healthcare and KFF aimed at monitoring the performance of the U.S. health system over time and in relation to other large high-income countries. Her work on the project focuses on trends in healthcare costs, access and affordability, as well as measures of healthcare and quality and outcomes. Before I turn it over to the presenter, just a reminder that KFS, as is APHA, is a nonpartisan group, and while they analyze the elections and candidates regularly, they do not focus on choosing candidates or engage in advocacy. So when we get to the Q&A, they're not going to be able to tell you who to vote for or why you should vote for one person, but I'm sure that they'll have lots of insights that will help us understand the of what's going to happen in the next few weeks. So with that, it is my pleasure to turn it over to Jen and Cynthia.
Great. Thanks so much, Susan and Angie, and to the Alliance and to everybody here. We're excited to be able to talk to you about this. We're 20 days out from the election, and as you all asked us to come, because I think we all know that there's a lot at stake for public health and health care in the United States based on the outcome of the election. And we have a lot of resources at KFF on this. And what Cynthia and I are going to try to do today is give you both a sense of what the resources are that we have, but also some of the bigger issues that we're tracking, and just present those and then really open it up to a dialogue with you. I'll start, and just one general comment that we were discussing before everyone came on. I think it's really important, just through line of all of this, which is that both candidates, Trump and Harris, have just and the different parties have a fundamentally different viewpoint of the relationship between the federal government and the states. And so whatever issue we talk about today, whether it's public health funding or vaccine, school vaccine policies, or it's Medicaid or health costs, that fundamental difference, and also the role of the private sector, is going to structure policy platforms and policy decisions. So that is a common through line. I'm going to share our slides. Let me find them. There we go. Okay, and everybody can see those? Okay. So as I mentioned, we have a lot of resources on the candidates and on the election. I will share at the end, we'll highlight some more, but this is one that we wanted to bring to your attention. We have been comparing the candidates on a range of health policy issues. You could see all of them underneath here. And for each one, we've kind of done an abbreviated side-by-side to try to highlight where there might be similarities as well as differences on a range of issues. We're going to talk about a few of those today, just to highlight them, spotlight them: public health, ACA, Medicaid, and health costs. There's plenty more here. And, again, in conversation, we're happy to share more. So this is the side-by-side that we did on public health. And I'm not going to read it all, but I think, what we tried to do here was say with Donald Trump, he actually has a history. He has a policy history that he's already established from being president, and as well as some campaign comments and things. And very broadly speaking, I mean, we tried to point out that there were some things done during the Trump administration that we wanted to, of course, credit here: Operation Warp Speed, and successfully developing COVID vaccines within record time, and promoting those at the beginning. But after that point, and to some extent before that, really beginning to downplay COVID, and then really having a lot of different views about how the federal government, or what the role of the federal government was vis-a-vis fighting the pandemic, and more broadly, what the federal government's role and job is around supporting public health infrastructure, public health policies at the state and local level, proposing budget cuts to CDC and other federal public health programs. And then as a candidate has, I'm sure as everybody knows, talked about stopping COVID mandates, penalizing schools that have vaccine mandates or mask mandates, talking about disbanding the White House Office of Pandemic Preparedness and Response, which he actually disbanded its precursor during his administration. So as a whole, his record and things he said are really more about letting the states make a lot of decisions about the public's welfare, but also sort of a hostility towards promoting public health as a federal through strong federal policy. Kamala Harris, on the other hand, and the Biden administration, Biden-Harris administration has sort of taken the opposite approach, initially committing, of course, to listen to science and public health advice in the response to COVID, continuing to support and enact new policies to combat the pandemic, including bolstering the public health workforce, establishing the White House Office of Pandemic Preparedness and Response Policy, and doing several other things, including continuing to talk about the importance of public health across the country, the importance of addressing health inequities. And I know this is going to be a topic at the meeting, but how do you combat health misinformation, which of course is a fundamental challenge we're all dealing with at every level in our public health response. That's all I'm going to say on this topic right now, but just to give you a sense, this is the kind of thing we have. And I'm going to turn to Cynthia next, who's going to go through a couple other of our side-by-sides, which I think help paint the picture between the candidates. Okay. Yes.
Great. Yes.
Cynthia, turning over to you.
Sounds good. Thanks, Jen. So I'm Cynthia Cox, and I'm going to be talking about some of the coverage and healthcare cost issues at stake in the election. So first, starting with the Affordable Care Act, I think generally speaking, to characterize the candidates' positions, although Harris had shown support for Medicare for all or Medicare for more several years ago when she was a primary candidate in running against Biden at the time, she has since switched to be, more supporting incremental steps to build upon the Affordable Care Act framework. And that's been consistent while she's been vice president, as well as during her 2024 presidential campaign. So, now more of her focus is on strengthening or building upon the Affordable Care Act framework. Most notably, I would say that includes the enhanced subsidies for people who are buying their own coverage on the ACA or Obamacare marketplaces. These enhanced subsidies were first passed during the Biden-Harris administration as part of a COVID response, and then they were extended by the Inflation Reduction Act. And these enhanced subsidies increase the amount of financial assistance that people across the income spectrum are getting. It makes ACA health plans free for low income people with very low deductibles too. For higher income people who previously had been eligible for no financial assistance on the ACA marketplaces, they now do get financial assistance because of these enhanced subsidies. And these enhanced subsidies are responsible for bringing ACA marketplace enrollment to a record high, doubling in the time that Biden and Harris have been in office from about 11 million people to 21 million people. And premium payments on the ACA markets have been cut almost in half for people on average. So the important thing, though, to note is that these enhanced subsidies expire at the end of next year. And so that would take no action from Congress. The enhanced subsidies would go away at the end of 2025 if Congress doesn't act to either renew them or make them permanent. And so Harris has supported making those enhanced subsidies permanent, but that would take an act of Congress, which would mean that if Congress is split between Republicans and Democrats, then the fate of these enhanced subsidies is kind of anyone's guess. So on the other hand, of course, former President Trump has famously opposed the Affordable Care Act for many years. When he was president, he supported a number of unsuccessful attempts to repeal and replace the Affordable Care Act, in particular in 2017. These proposals, although they didn't pass, would have led to millions more people being uninsured. In his presidential budgets, Trump also proposed to slash funding for the ACA, including for Medicaid. And I would say, looking ahead, it's a little bit harder to say what he is planning to do with the Affordable Care Act. As president, he had a very clear record, but when in his 2024 campaign, he has, I would say, flip-flopped a bit. He started out saying that he would never give up on repealing the ACA and saying that Republicans' failure to do so in 2017 was a low point for the party. He also has then kind of changed his tune sometimes and said that he is not running on terminating the ACA, but rather wants to make it much, much better for far less money. And then in the debate, though, he said that he had concepts of a plan to replace the ACA, but hasn't offered any specifics. And I can talk more during the Q&A about, I think Vance has made some comments that might shed some light on what this concept of a plan might look like. But I think the key here is that there's not really a concrete proposal for what Trump will do with the Affordable Care Act if he's elected and if Republicans control Congress. So there's certainly a lot of room for interpretation about his future comments, but you can look to his record, which is very clear that he opposed the Affordable Care Act when he was president before. Okay, so moving on to the next slide.
Trying to move it, just a
That's
sec.
okay.
Come on. There we go.
So on Medicaid, I just want to point out that a really key aspect of the Affordable Care Act was the Medicaid expansion. As many of you know, Medicaid, without this expansion under the Affordable Care Act, had primarily been a program that did not benefit able-bodied working age adults. It was primarily a program for very, very, very low income people or people who were disabled or pregnant people or children in some cases. But the Affordable Care Act expanded Medicaid to cover everyone who is poor or near poor. However, the Supreme Court early on ruled that Medicaid expansion was optional. So there are still some states that have not expanded Medicaid, and there are still some people who fall into this coverage gap, meaning that they make too much money to qualify for Medicaid in their state, but not enough money to qualify for ACA subsidies to buy private insurance on the Affordable Care Act marketplaces. So although this proposal was not successful, the Biden-Harris administration had pushed to extend private subsidies to those people in the coverage gap to provide some coverage option for the people in those states that had not expanded Medicaid. That, as I mentioned, though, that was not a successful effort because it was not ultimately passed by Congress. But Harris has personally championed expanding Medicaid coverage for postpartum care. So that is a key aspect of her views of Medicaid is trying to expand Medicaid coverage to more people, or by finding ways to cover people who are falling into this coverage gap because the states have not expanded the program. Trump, on the other hand, when he was president, as part of the ACA repeal and replace plans, I think it's really important to understand that these repeal and replace plans not only would have rolled back the Medicaid expansion, but also on top of that might have meant that other people who may have already qualified for Medicaid before the Affordable Care Act could lose coverage or could lose benefits. That's because his proposals would have block granted Medicaid, meaning that states would get a certain amount of money. That amount of money would grow at a slower rate than states are currently getting, such that over time, over 10 years, Medicaid spending would have been slashed by roughly $1 trillion. And so states would have been left in a kind of impossible situation of trying to figure out how to cover people or who to cover. And so it likely would have left millions more people without Medicaid. So moving on to the next slide. And then healthcare costs is a very broad topic. A lot of the things that I've already talked about obviously touch on healthcare costs, but I just wanted to mention some things that are less about health insurance coverage and more getting at the actual underlying costs of healthcare. So there's actually some bipartisanship here. The Trump administration used authority under the Affordable Care Act to improve price transparency. And so what this means is that people who are going to get what is called a shoppable healthcare service, that might be like an elective procedure, for example, should be able to look on a hospital website and see a list of prices. That was part of the hospital price transparency rule that the Trump administration created. Again, that was using authority by the Affordable Care Act to do so. And then the Biden administration has further built on those rules that were started by the Trump administration to expand that price transparency to health insurers as well. And so that's, I would say, a area where there's some bipartisan agreement. I would assume that Harris would likely continue to implement those price transparency rules. Also, although Trump didn't champion the No Surprises Act, he did sign it into law when he was president, and the Biden administration has worked to implement the No Surprises Act. And so essentially what this law does is it holds harmless consumers who inadvertently go out of network. So either in an emergency situation where they have an emergency care where that care was delivered out of network, or when they are, say, getting a surgery at an in-network hospital, but for example, a out-of-network anesthesiologist or other doctor sees them while they're in the in-network hospital, that patient does not have to pay the out-of-network cost. Their insurer has to cover it as if it is in-network, and then the insurer and the doctor or hospital have to work out the payment arrangement. And so, these are just a couple of examples where there is some overlap between the candidates. Also on prescription drug costs, Trump has claimed responsibility for the setting limits on out-of-pocket payments for insulin, although his program was optional, and the Inflation Reduction Act passed under the Biden-Harris administration makes that mandatory. So, there's also, I think, some interest in addressing prescription drug costs by both candidates, although I think there would be substantial differences in how that's actually implemented. Okay, and I think there's one more slide.
Yeah, I was just going to mention a few more resources, but a couple other things I wanted to say. Obviously, the line between health care and public health is a blurry one. And so a lot of the policies that Cynthia was talking about really have stand to affect the nation's health, public health as well. One thing that was not on our slides, but is part of the larger backdrop here, that's more about sort of differences between the parties and obviously what happens in this Congress as well as state and local elections will affect these, but there have been broader challenges, legal challenges on a whole range of issues. We're not talking, don't have our comparison here on abortion, but that's one. But another one that directly affects public health were the challenges to U.S. Preventive Services Task Force, and also potentially ACIP, although ACIP has so far been set as not subject to that, but raising the stakes again about the authority of federal advisory boards to, based on data and science, recommend to the public what services that are available, and that has implications on the payment side. So these are policies in flux, and I just wanted to flag them. And just lastly, we have a number of other resources. These are just a few. We have something new called Quick Takes, and a lot of us have been writing quick takes, are really short pieces on different aspects of the election, primarily, or things that are sort of very topical in the news. We encourage you to go to our website and look at those. There's one that our Larry Levitt at KFF, who probably many of you know, just wrote something on the ACA. We just released a big survey we do a lot of polling. We released a survey on women voters on a whole range of issues, and it was probably the most interesting thing about the survey is a resurvey. So we went back to women that had already been polled and asked them, once now that Harris is in the election, how their views and how those shifted. So I encourage you to look at that. And then also we have these state healthcare snapshots. So you can click on your state and get a whole range of data that are important to consider around some of these issues. So that was our last slide. I'm going to stop sharing. And we are open to your questions, comments, and anything else. Yeah.
So I will turn it over to John Orbach for the first question.
First of all, thanks so much. The work you do at KFF is amazing. Jen Cates, you're brilliant.
Hi, John.
I wonder if you just talked a little bit about some of the more sort of very public health issues, and I wonder if you could maybe just spend a little bit more time maybe speculating about those, like the future of CDC, maybe also like chronic disease. There's been some discussions about that with Trump pointing to Robert Kennedy Jr. on chronic disease. And HIV, environmental health. I wonder if the things that are a little bit more central to public health. It'd be great if you could maybe just distinguish between the differences of the two.
Yeah. Hi, John. Thank you. Sure. Yeah. So I think there's a fundamental difference in the view about this, let's say the CDC. And we know this, we saw what Trump, when he was president, was already doing to the CDC in terms of questioning its role, its leadership, its authority, and in the Project 2025 document that I know you'll be discussing, which the Trump campaign has not said is their policy platform, although what that's I think we might find out, we don't know, but there's obviously in there a very different view from the Biden-Harris administration on the role of the CDC, and some recommendations to fundamentally restructure the CDC, to split its activities between surveillance and sort of very traditional, some public health things and other things, and really I think diminish its role, which for those of us who work in public health know that CDC's authority in public health is fairly limited already, and it's really only able to provide advice and recommendations, but it's not able to force any state or individual, except for very limited circumstances. But that contested space that became so partisan and difficult during COVID has unfortunately, I think, spilled over into the current dialogue and view of CDC and public health. And so we would expect two things. One is, if, depending upon the outcome of the election, if there's a second Trump presidency, I would expect that the CDC would be hit pretty hard in terms of how the administration might want to restructure it or change its role in similar ways that they've said and tried last time, but probably with more purpose at this moment. Versus if Harris wins, I think we'll continue to see strong support of CDC, but also with some reforms. I think there's agreement that reforms are a good thing, and there should be some reforms, but I think what those look like and the ultimate purpose of those reforms is quite different. You alluded to Robert Kennedy. We don't know if Trump were to win, if he would have an official position, but clearly he has views that are quite outside the mainstream of public health on vaccines and many other things. And I think it just is a telling, I think it just all adds information that if there was a second Trump presidency, the view and support of public health would be very different and probably be diminished. I don't think the Trump as a candidate and as president saw a lot of value in providing more funding to the CDC or funding to the CDC that would support a strong public health response at the federal level. Would really want to defer to the states and let states make a lot of decisions. So we'd have probably more of a patchwork. There are some, HIV is a questionable one to me, because during the Trump administration, when he was president, his team was broadly supportive of the domestic HIV response, launching the Ending the HIV Epidemic initiative. There's nothing that I've seen or been said that would be questioned. I think and with strong bipartisan support for it still, I think the bigger issue there is whether it's public health and HIV or it's Ryan White on the care and treatment side, those programs are going to fall into the general battles around money. And the battles around money really are along partisan lines. Whether or not Trump's in the White House, it's going to continue in Congress. Historically, as you know, John, the Congress has been able to kind of withstand many of those, their proposed cuts, and then they don't go through. What happens in 20 days could affect that. On some of the other issues, I mean, I think I don't have much more to share on some of the details, but I think it's like that fundamental difference about the role of the federal government in protecting the public and providing the sort of glue that can nationally try to level the playing field for everybody. I don't think that's just a very different approach. I don't know, Cynthia, if you want to add anything.
No, I think that covered it great.
So I have a question, but people, please feel free to raise your hand or put a question in the chat. If there's something that you want to ask our speakers. So you talked a bit about the presidential race and the impact and the implications and the issues related to the presidential race. But we know you've also alluded to the importance of Congress in so many of these decisions. And so can you tell a little bit more about how these elections may shape Congress, what you're hearing from party priorities that would have implications for public health at the federal, state, and local level?
I'll start, Cynthia, and then maybe, I mean, similarly, the view, well, our resources are primarily focusing on the top of the ticket. I think that it's relatively understood that Trump's views on many of these issues are now the GOP views as a whole. And so in general, what we've seen on a lot of areas is that during the Trump administration and since, Congress and the Republicans in Congress have moved more in his direction. So there's been, I'll give you an example that's not about domestic public health, but it's, I also work on global health. And so as you might recall, during the Trump administration, President Trump's really called out and sort of castigated the WHO, and then began a process of formally tried to withdraw the United States government from its membership in the WHO. And the only reason that didn't happen is because the amount of time it took, the next election happened, and Biden came in and stopped the process. Since that time, though, there have been a number of bills introduced by Republican members to withdraw the United States from WHO membership, to restrict money to the WHO. So that idea that, that has permeated much more into the partisan differences. And I think that's also what we're seeing in the Congress on any oversight hearing, on whether it's, about COVID or any other issue, that the parties have really diverged. I mean, there's still there are Republican champions for public health in a broad sense, but I think these differences are more stark. And thus, what happens in Congress in terms of balance of Senate and House, the balance has been, it's a balance, and that balance has probably provided a healthy way to maintain more of the status quo, whether it's from funding levels or policies that might be seen as extreme by either side, usually are not able to get through. How much the balance changes after the election will affect that. So that wall of protection, whether you're looking at the protection from the side of the left wing of the Democratic Party or the right wing of the Republican Party, that wall of protection could be diminished from both perspectives. That's how, I mean, I think that's the long and short of it at a very high level. And if there's more empowerment for, let's say, Republicans in Congress to implement some of these viewpoints around the CDC and public health, we could see policies moving more in that direction. Yeah, Cynthia,
I guess I would just add, as far as like costs and coverage are concerned, I think, it's a little bit more obvious what would happen if either Democrats sweep Congress and the presidency or Republicans sweep Congress and the presidency. I think, as far as the Affordable Care Act or Medicaid, you know, if it's not just Trump who wins the presidency, but Republicans control the House and Senate, then then we're looking at potentially major changes to the Affordable Care Act and block granting Medicaid. Consistently Trump has talked about Medicare and Social Security being untouched, but Medicaid never gets mentioned there. And so I think it's likely that there could be really significant changes to Medicaid. And then on the Democrat side, then, like if Democrats sweep the House and Senate and Harris wins, then, we're likely to see a permanent extension of these enhanced ACA subsidies. But if there's anything in between, which is probably the most likely outcome, then, what we're looking at is, if Trump is president, but
Oh,
I think we could probably all finish.
yes.
Until
Yeah,
Cynthia
she'll
comes
come back.
Dr. Hearn.
Thanks, Dr. Poland. I have so many questions. This is a really
We lost you, Cynthia. You're
Oh, I'm
back.
sorry. Oh, okay. Yeah, the other thing to keep in mind is that there's been a number of legal challenges to the Affordable Care Act. Jen mentioned the preventive services, and there's likely to be a lot of challenges to prescription drug price negotiation and so on and so forth. And so depending on who wins the presidency, then that's also a question of whether the federal government tries to stand behind any of those issues or doesn't fight back in a legal challenge.
Thank you.
Thank you. Hopefully I don't freeze up. So no one has a crystal ball here. And though odds are, the Senate will shift to the Republicans, the House, unclear. We don't know on the presidential, but it's so important to look at historically what's happened and being prepared for those possibilities and what needs to be done in order to, whether it's defending basic public health organizations, the workforce, our laws, or if reforms are taking place, how to best manage that. And you all have been really good in watching this over time and looking at lessons learned. And I'd be curious, because we've had a lot of these, this is unique, but we also have had perilous times in the 104th Congress and reg reform, and so much was going to be dismantled in our public health protections. But there were lessons learned on how to take health issues to be translated to actually stop some of those egregious reforms that were going to hurt our agencies, were going to hurt workforce, et cetera. Given your polling, given the historical knowledge, and also as we try to build more advocacy capacity, being prepared to take on whatever those outcomes are, there are going to be changes. What are some of those issues that you see rising to the top, or some of the needs, some of the states? I'd love to kind of tap that brain power of both understanding public opinion research and historical trends of what's worked, what's not, in helping defend and advance a lot of these issues that we care about.
I mean, just broadly speaking, in general, and this has been long the case, there's two things that people have pointed out. Always providing the voice of actual people and their experiences, their day-to-day experiences with the healthcare system or with getting basic public health needs met for them and their families has been a motivator for policymakers from both sides. I'll come back to that. In addition, our polling consistently seems to show that, especially in this partisan time, people have a real the names or associations they have with a policy idea or person sort of trump no pun intended, the actual provisions in the policy itself. So we keep finding in our polling, people love all the aspects of the ACA. They want all those things. They just, when you ask them if they like Obamacare or the ACA, they don't. So so part of it is a real disconnect. But to come back to it, I think we see this in our work. It's a very much more challenging time now to combat or to bridge that gap, because there's so much dis and misinformation that I don't think anyone's figured out the best way to provide the correct information and let that speak for itself. Because there are too many, symbolically, there's just a lot of other forces that tend to be more popular. One thing that all Americans and people in the United States always say matters the most to them is their budgets, their day-to-day, their costs that they're facing. So that becomes very salient, and one that I think any policymaker would be very keen to understand. So I think, again, a lot of this is translating to take what seems very abstract. And I think it's really hard in public health, because so much of what we do is about preventing things from happening, and it takes place in the background, and it's not the day-to-day, like going into your doctor's office and getting a prescription. So yeah, I don't have any easy answer, but we do see that disconnect continually with our polls, and then the overlay now of dis and misinformation just makes it a very complicated landscape. I don't know, Cynthia, if you have other.
No, I mean, I think that's great. I guess I would also just add that I think when it comes to health insurance coverage or, health policy in general, one thing that makes the US different from many other countries is that I think we have long had a very different understanding of social solidarity, that has led to like very different policy making when it comes to covering low-income people, for example, or that sort of thing. And that I think that during the pandemic, that sense of social solidarity was strained even more, and than it may already have been. And that showed through in people's reactions to the pandemic. But I also think that that's probably at the heart of why there has been a willingness for people to believe disinformation or misinformation. Kind of comes from this distrust of one another and a lack of social solidarity. And I think that's kind of at the heart of how to address the misinformation crisis, but also it shows through in public health policy more broadly.
One thing I also relate to something Cynthia said reminded me, I think as we all experienced, fear is a motivator in good and bad ways. And I think the fear that set in during COVID, and then mistrust of messaging and all that, just so a lot of people's reactions today are based on a fear of not trusting information, feeling like they don't understand. It's such a murky area for them to understand a lot of the issues we're talking about, that the reaction is just to pull back and not be open to them. And that's been longstanding, but it's just gotten, I think, much more acute.
So there's been some chat in the chat about advisors to both parties, and there's some obvious names, but I wonder if you have any intel on who the primary advisors are on public health for each of the parties, or who we might expect to see rise up in the event that one or the other of these candidates is elected. Well, when one of the or the other is elected.
I mean, that's probably a little bit outside our scope. I don't know. I don't have insight into that. I think we can assume that there'll be some, if the only thing I can say is if Harris is elected, some of the same, it's not going to be like, I don't think, a major shakeup. There'll be new people, but there'll be some stability. If Trump is elected, I think a question is, will some of the prior people that he had in the administration come back, or on the public health side or not? But I don't have any insight on that.
I think one organization that you might want to be reading is Paragon, that's headed up by Brian Blaze, who had been in the Trump administration and has been writing a lot on the Affordable Care Act and other coverage issues. So I don't know if he personally or if Paragon is directly influencing the campaign now, but I think they can provide some insight into what a future Trump administration might be doing.
Shelley?
Sorry, I don't want to be piggy, but I didn't see anyone else's hand. I want to take advantage of having you. So many years back, NPR was under attack. was going to get defunded. And a advocacy campaign was put together, and based on a lot of research and conversations, Big Bird saved the day. There was a lot of finding the things that people could connect to, that cared about, had value to them. It was that shared bond. When Trump was elected in 2016, there were efforts to dismantle much of EPA. And one of the things that happened was I don't want to call it a shadow government, but another organization was set up to be a volunteer structure for all of the senior officials in Republican and Democratic Democratic administrations who had worked at EPA, who could be in one place to be a resource to help keep the agency functioning in a time of major assaults and challenges. And so I'm not wanting to imagine a worst case scenario, but I do feel, having learned that I didn't think 2016 could happen, and it could, be more prepared this time and thinking CDC and many of the issues we care about will be under attack, and thinking about what might be the kinds of infrastructure, messages, things that would pull us together, regardless of our party affiliations, our range of values. Thoughts on what might be helpful to be thinking about that could help for what is a possible scenario. I'm coming up with easy questions.
I mean, I think just from the viewpoint of like the Affordable Care Act, repeal and replace and everything, I think the concept of pre-existing conditions had a lot of traction. I think the idea of protecting people with pre-existing conditions is now something that you hear Trump and Vance say. I don't know if that's lip service exactly, but it's, because that's certainly not necessarily what would have happened if the repeal efforts in 2017 had been successful. But I think, that is a topic that seems to resonate with people. We've done studies that show that, basically 1 in 4 people have a pre-existing condition. And so that means that most people have someone in their family who has a pre-existing condition. And that maybe that's not exactly Big Bird, but it is like, I think something that many people care about and can resonate with. I noticed early on in the Trump administration, before ACA repeal started to really get traction, that in meetings with advocacy groups, they seemed very focused on their own disease area, like cancer or HIV or lung disease, or that sort of thing, and didn't necessarily connect the dots that all of these are pre-existing conditions, for what that's worth.
So I have a follow-up question, and again, please put your questions in the chat or raise your hand if you have something else. But one of the things we've heard from both parties and people up and down the ballot is the importance of listening to communities and letting communities lead, and not necessarily having a top-down approach. Can you talk a little bit about how some of the issues that we're talking about the implications for having communities lead, or where how this might play out differently depending on which party we're talking about?
Very good question. The short answer, how to characterize it. It is the case that the Biden-Harris administration has put in place multiple ways to more formally solicit community input on things like what during the pandemic and other things, and has promoted, has a view of the community as in all of its diversity as having a critical role as an input into public policy. I'm not sure that that same strong view would be the case of a Trump administration. So what we might, it's not that some community voices wouldn't be heard, but I think the emphasis on promoting a very wide range of diverse opinions and that people who are more disadvantaged have as much potentially to offer as others might not be as supported. This is a delicate one because I don't know, but I think that's what we've seen so far. And it does put a lot of onus on communities because communities aren't necessarily funded to do this work. And my familiarity with community is primarily from the HIV side and have watched that community, which is itself diverse, try to navigate some of these areas. But I think whatever the outcome of the election, community will continue to be a huge, important voice. Who hears that voice and how they use that information will vary and be quite different between the two outcomes. But I don't have any other magic answer there. Yeah. I don't know, Cynthia, any thoughts?
Kelly, I'm sorry, Cynthia, were you going
Oh,
to?
no, I don't have anything to add there.
Hi, Jen and Cynthia. Thanks for this conversation. Just curious, coming from KFF, your sense of the conversations that philanthropy is having in this moment about the different scenarios that could potentially play out. I think philanthropy can often be reactive, and I'm curious if you're seeing any proactive steps or conversations that you might have insights around at your tables.
Well, just in the interest of full disclosure, we are not a philanthropy. We're not a foundation. So we don't have insight as a foundation or philanthropy into that. But I do have insight in my day-to-day work because I interact with philanthropies. And I think that in general, the philanthropies that I interact with are not all of them are very steeped in the policy environment, all the sort of ins and outs of what happens in DC. So I think for several, it's really trying to stay abreast of what the inner workings are and what they mean for their work. Some are paying more attention to this. But I think everyone's very cognizant that the outcome will affect the needs that they try to address, and could put could create more gaps for some of them. But in general, with few exception, most philanthropies are, again, they're not steeped in the detailed policy working. So what we've done a lot, or what I've done a lot, is a lot of education for different ones, just try to help them understand the landscape.
Yeah, I think that some of the philanthropies I interact with are more steeped in the policy, from the costs and health insurance coverage kind of space. And I think one of the things that people are looking at is entitlement reform if Republicans win in particular. And so I think that's likely on the agenda and something that philanthropies are starting to think through what that might look like.
Thanks for
just to add, our colleagues who work on our women's health issues are not here today, but certainly on anything related to women's health care, including abortion, the philanthropies that are most involved in that are paying very close attention and are very steeped in implications and policy differences. Yeah.
Jill, next question.
Yes, thank you. Jill Rosenthal with the Center for American Progress. This might be a hard question, but I'm wondering if you hear anything about what the Biden administration might consider through the rest of this term. So if Trump were to win, are there things that could be happening right now that could kind of bolster the public health system and prepare for some of the things that might happen?
I haven't heard any specifics in that. Jill, I feel like you probably know more than I do, to be honest.
Same. I mean, I think there was a few, there was a push to get regulations out within by a certain time frame because then they run into congressional review. But the executive has only limited, if there were certain steps that the executive were to take, they could easily be reversed by another executive. So I don't know how much room there is there.
Yeah, thanks. I was just,
Yeah.
we're thinking about it, and I just wondered if you had heard anything, so I appreciate the thoughts.
So the other thing we'd love to hear from the folks who are part of the audience today are, what are you and your organizations doing to begin to prepare for new administrations at the federal level or the state or local level? And how can we at the Alliance create this table to be able to maximize that work and value add to that work so that we're not working in, not in opposition, but in silos? Are there other things that you're doing that you would look for support from some of our colleagues who are sitting at this table? And while you think about that, Lori, I'm going to go to you first, and then Jill, I'll go back to you.
Yes, thank you. Great to see you all. So we are about to release our transition document for the new administration that highlights all of the priorities for local governmental public health, but there's a lot of general public health in there as well, obviously, as well. And, all of the programs that are necessary to sustain that part of the system, but also other parts of the governmental public health system. That should be coming out actually within a week. So look for that. I'm happy to share it back with you all as well.
Great, thank you. Jill? Jill, is your hand up from your last question?
Oh, it is. Yep. Sorry about that.
No biggie. Okay. So let me take this time. We're basically out of time. Thank you so much, Jen and Cynthia. I think that this was both an incredibly timely and important conversation, and you really helped lead us, to better understanding. And I so appreciate that. To the folks, if you have any updates or announcements, please share those in the chat. And we look forward to seeing many of you, hopefully at the annual meeting in Minneapolis in just a week and a half. And then reminder that our next Alliance meeting is in Wednesday, December 4th. So again, join me in thanking Jen and Cynthia, and we will see you all soon.